Welcome to the Poisoning Podcast. I'm your host, Erin DeLullo. I ask that you rate, review, and share this episode with a friend. Today, I am happy to have Director Tony Mattivi. He heads up the Kansas Bureau of Investigation. Welcome to the show, Tony.
Hi, Erin. Thanks for having me here.
It's so good to see you. I do want to let our listeners know that we have worked together in the past, but we haven't chatted too much in a while, maybe a few text messages. But why I have you here is because of all the experience you've had in your role with fentanyl. Can you start telling me how fentanyl has shaped your job when you started and what's going on in Kansas right now?
Sure. It's hard, really, I think, to overstate the nature of the problem that we're seeing with fentanyl in Kansas right now. We're seeing a lot of deaths. We're seeing fentanyl in every single community in our state. We have 105 counties in Kansas. The sheriffs in those counties will tell you that there's not a sheriff in Kansas who hasn't had a fentanyl case. It's in the metros. It's in the rural areas. Wichita and Kansas City are both distribution hubs. And it's killing kids in our community every single day right here in the Midwest. And so I've been in this job about 19 months. The KBI director is appointed by the Attorney General. So I was appointed by Chris Kobach. And when Attorney General Kobach appointed me, the directive that he gave me, one of the directives is, I want you to do everything that you can do to interrupt the flow of fentanyl into and through the state of Kansas. So we have made it a priority here. The KBI is under-resourced and underfunded compared to what we need to do, right? Of all the expectations and demands from our clients, our customers, our constituents. So we have to have investigative priorities. We can't respond to every request for help. So we prioritize violent crime, crimes against children, public corruption, and fentanyl. So I was very surprised to find out when I got here that in Kansas in January of 2023, there was not a single law enforcement canine that was capable of detecting just fentanyl. So
Really?
all the canine programs that we had here in the state, those dogs were trained to detect meth and marijuana and heroin and cocaine. And if the fentanyl was being packaged along with one of those drugs, then of course the dogs could find it. But we were seeing then and we're seeing now a lot of fentanyl that's being trafficked by itself, whether it's powder or pills. And so we really were flying blind without canine detection capabilities. So one of the things that we did right away was we went out and we actually got funding from the feds and we started a 4 canine program. And in addition to being trained on the other drugs, our dogs are trained on detecting just fentanyl. So that's been hugely helpful. There are now lots of fentanyl trained dogs across the state, but that's been hugely helpful. Another thing that we did here is we established what we call the JFIT, the Joint Fentanyl Impact Team, which is a true partnership, a collaboration between the Kansas Bureau of Investigation and the Kansas Highway Patrol. And it was an attempt to sort of eliminate the stovepiping that existed when it came to drug investigations, particularly fentanyl. So we wanted to get those two agencies working together. And then we have partnerships at the federal level with DEA, HSI, ATF, FBI, and now we're even having some locals participate in the team as well. So we're really excited about the work that the team is doing. They're making buys. They're out in the communities literally every single day. Very, very busy. They're taking a lot of fentanyl off the streets. And so I'm excited about what we're doing, but I'll tell you, Erin, I say over and over again, I can talk to you for hours about our targeted enforcement efforts, but the only way that we're going to get out of this crisis is through education. And we have to educate. We have to let people know what's going on. We have to let people know how prevalent this is, how dangerous it is, and we have to educate people, especially the kids, that it is just too risky.
I 100% agree. So you have a history of fighting bad guys or helping put away bad guys, if I should say that correctly. You helped prosecute or was the lead prosecutor in the USS Cole bombing with one of the Al Qaeda members. You served with the Justice Department in Guantanamo and Iraq, right? So, with that type of background, what you're seeing with these people who are trafficking fentanyl, do you see much of a difference between those, the international terrorists, and the ones here pushing fentanyl on our citizens?
Uh, So I'll tell you that terrorist organizations like Al Qaeda, Al
Mhm.
Shabaab, Hezbollah, they're very much like organized crime. And organized and criminal organizations include the drug cartels, right? So there's a lot of similarity, there's a lot of overlap. But I will tell you that in Kansas, there is no fentanyl that's being brought into our state that isn't being trafficked here by one of the cartels.
Okay.
So in years past, it was marijuana, it was cocaine. When I started as a federal prosecutor in 1998, it was under a HIDTA grant, high intensity drug trafficking area, to do meth lab cases.
Mm.
And at the time, we had a lot of little mom and pop labs all around the state, just like everybody in the Midwest. And I mean, we still have a meth problem here in Kansas, but we don't. It's not the labs anymore. Meth is being transported into our state by the cartels. So the cartels pushed the mom and pop labs out of the way. The cartels brought in the meth for many, many years. They continue to do so, along with cocaine, along with weed. And when fentanyl came into the picture, uh, the cartels realized very quickly that this is the most profitable drug our society has ever seen. And even though when it came on the radar back in 2018, 2019, it was a product supplied by the Chinese, once the cartels figured out how profitable it was, they elbowed the cartels elbowed the Chinese out of the way very quickly. So, you know this, Aaron. I'm not
Yep.
telling you anything you don't know. We see now the precursors being
Yes.
sent by China into Mexico. The cartels are taking those precursors and manufacturing fentanyl in their jungle labs in Mexico. And then from there, it's being trafficked into the United States. And whether it's powder or pills, liquid is there, but we don't see much of it. We see powder and pills. We know that from a Kansas perspective, it seems to be coming primarily into Wichita, a little bit into Kansas City, and we know that the fentanyl that's coming in here is coming from our southwest border. In fact, there's a certain region of the southwest border. I don't want to get into too many specifics, but we know that that's where it's coming across into one of those southwest border states, and then it's being transported from there into Wichita and Kansas City and distributed through the state from there. And it is all cartels. This is purely a cartel provided, cartel distributed product.
Yes. I almost now equate this to terrorism just because of how many people are dying. They're not seeking out, very few people seek out fentanyl. They might be seeking out an illicit drug. They don't know they're going to be poisoned by fentanyl, and this is what those other countries are doing to us.
Yeah, you're absolutely right. And I mean, I think that's a really insightful way to look at this. And the reason is, I think fentanyl really is a weapon of mass destruction. And we haven't yet seen it weaponized.
Hmm.
That's a different discussion than we're having today,
Sure.
right? Today we're talking about all the damage that this is inflicting in our communities. We haven't seen fentanyl weaponized yet. We will. We absolutely will. There's no doubt about it. It's cheap, it's lethal. We will see it weaponized. Your viewers might have heard, last June, not this past June, but 14, 15 months ago, we had an incident here in Kansas where a still unidentified person mailed white powder letters to legislators. And it
Mm.
turns out it was an inert substance. Nobody was hurt. It would have been very easy for that person to have put fentanyl in those letters. And if that were the case, we would be dealing with a situation which I'm convinced there would have been multiple fatalities. So we haven't seen anything like that yet. I know that we will. That's how dangerous this stuff is. So I don't think you're wrong at all, Aaron, in looking at it that way.
Thank you. Um, let's talk about your colleagues and the people that work with you that have been exposed to fentanyl. Can you tell us a few stories about that?
Sure. The two most compelling stories here are we have a career KBI drug agent who lives and works in the southeastern part of the state. This guy's devoted his career to drug investigations and drug work and trying to keep drugs out of his community. April of last year, on a Friday morning, his wife's birthday, they woke up and found their 18-year-old son
Mm.
dead in his bedroom in the basement. And Cooper was his name. And Cooper, they reconstructed what happened. An investigation was conducted. Someone was arrested in that case and is being prosecuted right now. I mean, we
Wow.
weren't involved. Obviously, we can't be
Sure.
involved in the investigation when one of our people is the victim. Um, but Cooper wasn't looking. He didn't ask for fentanyl, right? This
Right.
is one of those what we
Poison.
call fake pill cases where he got what he thought was an Adderall, and it had not only did it have fentanyl in it, it had a lethal dose of fentanyl in it. So, that's one of the reasons that I never turn down an invitation to go out into the community and talk about fentanyl, and try to raise the awareness level, try to educate people. But the story that I have to tell, I think, pales in comparison to the story that Sean has to tell. And so he's been getting out there into the communities. He's been getting out
Right.
into the schools and talking about his perspective and his family's perspective on this problem. And one of the things that I tell people over and over again is, if it can happen to us, it can happen to anybody.
I agree.
People ask me all the time, what's the biggest myth about fentanyl? And I tell them, I think there's three. It can't happen to my community. It can't happen to my family. It can't happen to me. Those, in my view, are the three biggest myths about fentanyl. And for us, that's a very personal experience. Um, the other one that I think is really compelling is we have an agent here who is just an incredibly prolific and incredibly talented undercover, and does a lot of undercover work around the state and around the nation, and is routinely involved in buys of hundreds of pills at a time, 100 pill quantities plus at a time
Wow.
from cartel level folks. And he had a situation where he made an undercover buy, and as he drove away from the buy, he recognized that he had been exposed. And what he describes it as is a wave of warmth and euphoria came over him. And he got on the radio and he said, "Hey," and he told his backup team, he says, "Hey, you guys, I've been exposed." And by the time the other agents got there, he was unconscious and unresponsive. And so they pulled him out of his vehicle, and administered Narcan to him, and he's what we call a Narcan safe. And so you and I were talking a little bit off camera,
Yeah.
Erin, about the people that are out there, telling this tale that there's no such thing as a transdermal exposure. I've got an agent here that I think would disagree with that pretty profoundly. And I'll tell you that, one of the things that I advocate for quite a bit is the increased availability in Narcan. I think that that's one of the tools that is absolutely vital to this battle. And I think you know this, Aaron. I mean, I was a paramedic in a prior
That's
life,
right.
and I've administered Narcan many, many times, and it really is a miracle drug. If you have somebody who's in an opioid overdose, back when I was
Yeah.
working on the streets and giving Narcan, I was a paramedic in Denver, and we had a horrible heroin problem at the time,
Yeah.
and so that's the context in which I've given Narcan. And back then we did it very differently. It was in an ampule. You had to draw it into a syringe, and then you inject it either through an IV, or intramuscularly. But it
Right.
would take a patient who is unconscious, unresponsive from an opioid overdose, and within 30 seconds they would be up and talking to you. And there's no downside to giving it. If the person is unconscious and unresponsive for another reason, Narcan isn't going to do them any damage. But if they're out because of an opioid overdose, it will save their lives. So the problem is, as fentanyl is being used more and more, as
Mm-hmm.
more people are using more of the drug, one of the things that we're seeing is an increased tolerance level. I mean, that's just
Right.
natural with regard to a narcotic, right? So you see people who one kit of Narcan, one dosage of Narcan isn't enough to bring them around. Um, and
Uh,
I've,
No,
I've been around
sorry to
one for a
interrupt you.
while.
I am a big
Yeah.
believer in the higher dosage. I mean, when
Yeah.
you read story after story of, well, one, it already comes in two in a kit
Mhm.
because they know the one isn't always going to work. And then you hear two, sometimes three, it's being used to bring someone back.
Yeah. So I'll take one more story, and then you can stop me
Yes,
there and
please.
redirect me if you want. So I went out to Dodge City, Kansas.
Yeah.
It's been a few months ago now. I think it was last spring. Went out there and spoke to their United Way luncheon, the monthly luncheon of the United Way, and I spoke about fentanyl. Um, and it's my standard spiel about, what we're seeing, how big the problem is, how fentanyl is everywhere in the state. It's in every demographic. It's mixed with other drugs. What we're doing at the KBI, how important education is. So I gave that presentation, and I came back to Topeka. And by the time I got back to Topeka, I had a call from the sheriff in Ford County, which is Dodge City,
Mhm.
Kansas. And he told me that in between the time that I left Dodge and got back to Topeka, the EMS in Ford County had run an overdose, a female in her late 20s, and it took 27 doses of Narcan to bring her back.
Amazing.
27 doses to reverse the effects of the overdose.
Well, I'm glad
So,
they didn't give up. I'm glad
right.
they kept trying.
Yeah, exactly. So I don't know if you've seen these. This is a training aid that's
Yeah.
out there. And
Oh,
so
good.
this
Please
is,
show us.
yeah, so this is what a Narcan kit or dosage looks like.
Yeah.
This isn't one, this is just a training device, but this is how it is now. I told you back in the day, it was in
Hmm.
an ampule. We used to draw it
Yep.
into a syringe. So now it's preloaded into this little device. If you have someone unconscious, unresponsive, you put this up their nose and you press the plunger, and that's it. That's all you do. And so it's very
Simple.
easy. These training devices are out there. I carry Narcan. I have it in my briefcase. I have it in
Good.
my glove box. My wife has it in her glove box. I've given several dosage kits to my 21-year-old college senior daughter and taught her how to use it, and her friends. And I think we can't get enough of it out there. I personally, I would love to see Narcan in every AED, right? We as a country have done
Same.
a good job of getting AEDs out there into the community. I think that every AED ought to have several doses of Narcan in it. And that way, if someone's unconscious, unresponsive, you go for help, whether you're getting the AED or
You know
what, there's
where it is.
Narcan right there. So that's what I advocate for.
Well, thank you for advocating for that. I To our Substack readers, I did a video on where I keep my Narcan in the house, and it was an idea I actually have to give credit to my husband for because I was thinking if you're sending Narcan home with someone, it's a larger box, right? There's two ampules in a kit or two nasal sprays in a kit. Maybe you put it may not fit in your medicine cabinet. Can't think of where to put it. So I put mine on the fridge. It's magnetized on the back because then you're seeing it constantly. So you sort of know and that it's there. And you sent me a very interesting picture. Can you tell me about the scenario where that picture came from and then describe it?
Sure. So our agents were doing a long-term operation down in Wichita, and we have an agent, a female down in Wichita who operates undercover and makes purchases of quantities of hundreds of pills, fentanyl pills at a time. And she had made a couple of purchases from a particular dealer in Wichita, and the team used one of those purchases to get a search warrant for this guy's house. Our SWAT team, we call them HRWT, the high risk warrant team. The guy was known to be armed, so the HRWT executed the warrant. A guy ran out the back door, he had his drugs in a coffee can in a sock, and he grabbed that when he saw the team approaching, ran out the back door, tossed the sock over the fence. Fortunately, it landed right at the feet of one of our canine officers who was assigned to watch the back fence.
Wow.
But he grabbed it, went inside the house, and when we got inside the house, he had Narcan um, on a piece of cardboard with with the word Narcan spelled out, and it was taped to the door of his refrigerator. And that's the picture that I sent you because I knew that you would appreciate that. So that's something that we saw in a fentanyl dealer's home in one of the cases that we've worked here at the KBI.
Didn't know I'd be on the same wavelength as a fentanyl dealer, but but you want to know where it is. So,
Yeah.
and I think the glove box is another
Mhm.
great place to keep it because if you're out, like we were at the county fair this week, and it actually hit me. I was like, okay, I hope I'm not the only one who has Narcan. Just you're in a large crowd, you don't know people's behaviors. You never know.
So I'll tell you two things about Narcan. One,
Hmm.
having given it, the thing that people don't think about is when you wake that person up, I will tell you that in my experience, more
Yes.
likely than not, they're going to fight you,
Right. Oh,
right?
it's not a good feeling, right?
So my suggestion is don't give Narcan to anybody unless you've restrained them first, even if you just
Mm.
have a couple people helping hold down their arms and legs.
Oh,
I wouldn't give Narcan unless the person was restrained first, right? So I'm not saying
interesting.
don't give it. I'm saying give it, but make sure you got somebody sitting on their legs, and holding the arms before you give it. The other thing that's interesting about Narcan is it works. It works also on canines. So the same Narcan that works on a human
Yeah.
works on a dog. So
Hmm.
our canine handlers, those dogs are out there looking for fentanyl every single day. So our
Hmm.
each canine handler has a cargo pocket full of Narcan kits. And we haven't had any of our canines exposed, but the handlers know that if one of the dogs is exposed, they administer Narcan to the dog just like they would to one of their human colleagues.
Be curious to see if the dog fights back, if that was a situation.
Yeah, that wasn't the
Um,
segue. I'm not saying the dogs. There's no relationship between those two stories.
no,
Sorry.
I'm teasing. And I maybe shouldn't be laughing about overdoses, but it's those dogs are doing a great service. I'm so glad you're doing that. So the sock, can this sounds like a child sort of. Let's go back to the story with the refrigerator. He kept his fentanyl, which, you don't need a lot. Obviously, 2 milligrams per
Two,
person.
2 milligrams is a fatal dose.
Milligram.
Enough to fit
Fatal
on the
dose.
head of a pencil. Hmm.
So like, do you have an estimate on how much was in a sock? Which seems very teenagerist, like where they were hiding like candy or something.
Um, so I don't. I know that we inventoried what was seized. I don't
Sure.
remember off the top of my head what came out of there. I'm thinking it was a few hundred pills. There might have been a small quantity of powder, and there were some other drugs as well. I mean, one of the things
Okay.
about fentanyl is we almost never see it when it's being sold. We almost never see it by itself. It's not like there
Okay.
is somebody who is a fentanyl dealer, and if you want fentanyl, you go to this guy, and if you want marijuana, you
Interesting.
go to that guy. No, there's a
Right. It's a
drug dealer,
mixture.
right?
Yeah.
And whether you want marijuana or weed or fentanyl or the Adderall, the Percocet, the Xanax, whatever fake pills that person has, that person's going to have the entire panoply, right? And so we call it the trifecta. Usually when we see fentanyl, we see it along with weed and meth here in
Oh,
Kansas.
interesting.
That's if we arrest somebody for fentanyl, usually they have marijuana and methamphetamine as well.
Okay, so you're really only seeing it in its post-production.
Yeah, so we have had one bust here in Kansas. It wasn't us, it was Wichita PD and Sedgwick
Okay.
County had a large pill manufacturing operation with presses. When
Wow.
we intercept a package or when the highway patrol intercepts a load on the highway, usually we're seeing pills. We're predominantly seeing sizable quantities of pills. It used to be we'd see a few hundred, then we would see a few thousand. Now it's not unusual at all for us to see tens of thousands of pills, and I'm aware of an arrest here in Kansas not too long ago where it was more than 100,000 pills in one load. Um, we'll also see powder. Usually, when we see powder, the purpose of that powder is they can take that powder and press it into pills and then sell the pills. But you,
Okay.
but that's going to sell pills is buying the pills. Usually, when we see powder, it's because they intend to mix that powdered fentanyl with something else. right? They
Okay.
intend to mix it with meth. They intend to mix it with crack. They can liquefy it and spray it on marijuana. So when we see powder, that's usually the purpose of it is it's going to be mixed with one of the other illegal drugs.
Got it. There was also, since you brought up your colleague Sean's son, Cooper, I just read, I think it was last week in Axios, there is a pharmaceutical shortage on Adderall right now.
Mm,
So getting it just your standard way, if you have a prescription for the people who need it, which makes me think people might turn to other methods to procuring it.
yeah. It's interesting. People ask, when I tell people that fentanyl is a cartel produced, cartel
Hmm.
distributed product, and they know that all of these people are buying fentanyl and they're dying from fentanyl. And they
Yeah.
say, well, what's that doesn't make any sense. What's the business model? Why would they intentionally kill their patients? That's not the business model, right? The business model is expose as many people as you can to that high, have as many people as possible chasing that high, and you've created customers, right? The business model is create as many customers as you can, and because of the unreliable and inconsistent way in which it's manufactured, you get very inconsistent mixtures, and sometimes you get a mixture that is going to be enough fentanyl to kill somebody, and if they kill somebody, it's just a cost of doing business, right? they,
Right.
they don't care. Their goal is to addict as many people as possible, and if they kill somebody's 15-year-old kid, they don't care. It doesn't
Right.
matter. It is all about money for them. It's all about greed, and that's one of the things that makes it so dangerous.
I've read that part of China's argument to our federal government is that we just have so many addicts, which, true, there were more opioid addicts created during sort of the opioid epidemic, right? When people were just overprescribed pills, and we had over 1 million new opioid addicts in the country that weren't looking to be opioid addicts necessarily. So
Yeah,
you have those folks, but I find even more interesting are these online dealers who are targeting the youth and sort of luring them in. What are you seeing in Kansas there?
we see fentanyl distributed. I'm not going to say entirely,
Sure.
but predominantly online,
Yeah.
using Snapchat,
Hmm.
using Messenger, using Telegraph. We know that the dealers are talking to each other on encrypted apps, but they're using social media platforms like Snapchat to sell to the end user. And I'm gonna push back on this argument to the extent people are saying, "Hey, this is because of the addicts."
Okay.
Um, those are not the people that we see dying on a daily basis. Do we see some? Yeah,
Sure.
absolutely. But Aaron, I mean, the fentanyl overdose is now the leading cause of death of Americans under 40 years old. Leading cause of death of Americans under 40. Think about that for a minute. More than
It's
gun
shocking.
violence, more than automobile accidents, more than suicide, the leading cause of death. And sure, we see some addicts who overdose and die, but when you look at the faces of the people that are dying from fentanyl, to me, it looks like you're just ripping pages out of a high school yearbook, right?
Mm,
I mean, those are the people, those are the Coopers, those are the
mm,
people that are dying from, maybe they were using fentanyl pills and it was just a lethal dose, but so many of them aren't. I mean, they think they're getting a Percocet, they think they're getting an Adderall, and they're trading it with their friends at school. And we tell people, if you didn't get that drug from a pharmacy, you have no idea what's in it. These pill presses
yeah.
can make, you know, what you think is an Adderall, what looks to you or me or what looks to the scientists in our lab like an Adderall, and it's not. It's a fake pill. It's got fentanyl and some binder, and that's all that's in it. And if you didn't get it from a pharmacist, you have no idea what's in that pill, and it really is just too dangerous to experiment with. It's too dangerous to play Russian roulette with your life.
So, yeah, so let's, I do call it The show is called The Poisoning. My Substack is called The Poisoning. What is your viewpoint on that?
I love the fact that you're trying to educate people. So I am fairly well read on this issue. Since I've started reading your email, you always have articles in there that I haven't seen.
Oh,
And
wow.
so I look forward to your email because you've got coverage that I haven't seen yet. And so I always click on the links for the articles that I don't recognize. And I I am fairly well informed on this issue. Erin, I learn something every time I read your email. So I'm grateful that you're doing that. You
Thank
heard me
you.
say we'll never enforce our way out of this.
Yeah.
There's two ways we get out of it, right? One is enough people use it and die that there's no longer a demand. I don't think that's an acceptable way to try to get out of this epidemic, right? The other way that we get out of it is we educate people and we help,
Yeah.
especially the young people. First of all, the people who are addicts, we need to help them recognize there is help. It's out there. Sometimes it's a challenge to find it, but you've got to get out
Hmm.
there and find help. That's not my wheelhouse. I
Right.
think we need to do a better job of making those resources available to people. Um, but it's the other end of the spectrum, that I'm thinking about, and we just have to educate those people on how dangerous this is. We've seen a death here in Kansas of a young person who thought they were smoking a joint, and it was a joint that had been laced with fentanyl, and in fact with a fatal dose of fentanyl. So it is just so incredibly dangerous to experiment with drugs, and even with drugs that aren't, like I talked about the fake pills, right? What you
Yes.
think is an Adderall, what you think is a Percocet, what you think is a Xanax. You have no way of knowing that there's not a lethal dose of fentanyl in there. So we have to educate people. I mentioned to you earlier, I never say no to an invitation to come talk to some segment of the community about fentanyl. And it is still amazing to me how many people out there don't understand the magnitude of this problem. um, I don't get it, and we have to do something to try to address that.
I'll go back to my example of being at our county fair this week. Our teenager, younger teenager, runs off with his friends. Fine, we're there, whatever. But the conversation we had to have is you can't take anything. I don't even want you to drink a soda that's
Hmm.
open that someone gave to you.
Hmm.
Like, that's just got to be like almost the line
Yeah,
in the sand with us. So we're like, nope, if it's not wrapped, if it's a pill, nothing. You
yeah,
can't you can't do it these
yeah.
days.
The other thing, I think probably where you were going with your question, Aaron, was
Hmm.
calling it the poisoning.
Yes.
Right? We talked about that, and first of all, I think you're absolutely right. But I mentioned to you in an exchange when we first started talking about this, um, the nomenclature is important. And it's important to the public, but it's not just important to them, it's important to us in law enforcement as well. And that is, law enforcement has treated overdoses for years and years and years. We treated them like accidents.
Mm,
Um, and
yeah.
if you have fentanyl, whether it's in a fake pill or mixed with marijuana, that's not an accident, right? Somebody intentionally introduced fentanyl into that product. And if
Exactly.
somebody dies as a result, that's not an accident. That's a poisoning, and that's a crime. And even in law enforcement, we have to shift the mindset away from treating these like accidents because they're not. The problem with that is law enforcement's response to an overdose, to an accident, is down here, and law
Yes.
enforcement's response to a crime is up here. And if it's a homicide, it's up here, right? And so we've got law enforcement organizations that are already overburdened, they're already under resourced, and we're telling them you can't treat these fentanyl overdoses as accidents. You have to treat them as a crime. And that's true. We do. We have to treat them like a crime because if we lose that evidence, right? We know these kids are on Snapchat communicating with their dealer, making arrangements for the purchase. And if we don't grab that information within the first couple of days after the death, it's gone. It's not available to us anymore. And so that's why we can't treat it as an accident. We have to treat it as a crime. But the amount of the burden that places on law enforcement with the additional resources that are required is huge. And you've got these small departments that are already struggling, but we have to change the mindset or we're not going to solve these crimes.
Thank you for advocating for that. Um, the stories I've heard where some sheriffs wouldn't even allow their officers to carry Narcan because they're not in the healthcare business. The mindset in law enforcement needs to continuously evolve to beat fentanyl.
Yeah,
So thank you.
I've had sheriffs here say that uh, they don't support the widespread availability of Narcan. And
Mm.
the reasoning that I've heard is, you know what a Narcan party is, right?
Oh, of course.
Right. And so their attitude is, well, that's like giving a needle to a user, right?
Mm-hmm.
Um, I disagree. Narcan parties, I mean, that whole idea is really disturbing, right? The fact that
It
you have a
is.
bunch of people that are using together, and so they have somebody that's basically a designated driver who has the Narcan. People overdose, they administer the Narcan, and 30 minutes later they're back to using. Well, that's unfortunate. But in my view, we know that Narcan saves lives, right? The
Exactly.
stat that we're seeing is there are 2 Narcan saves for every overdose fatality.
Wow.
And that means if you have 500 overdose fatalities without Narcan, at least in theory, you would have had 1,500 fentanyl overdose fatalities, right? And so um, the people that oppose the availability of it because of things like Narcan parties, I just disagree with that. If it saves a life, in my view, it's worth having out there, and we know Narcan saves lives.
It does. It does. Well, thank you so much for your time. It was so great to see you.
Sure, thanks for having me on. Nice to
Oh,
see
of
you too, Erin.
course. You're going to make the newsletter. I ask that you rate, review, and share this episode with a friend.